Hey, y'all. It's me, nurse practitioner Dr. Katina. I am here with some health information for you. If you're new to me, don't forget to follow me on social media, IG, Dr. Katina underscore Dr. K, and YouTube, Dr. Katina, for all of my past videos. I have so many, and one might be just for you. All right, so I've gotten the inbox and they said, why don't you talk about HIV? This is a person that actually has a partner who has HIV. And they're trying to decide whether they're going to have sex with them or not. All right, that's the question. Yes. All right, so let's talk about HIV. HIV, human immunodeficiency virus. That's what HIV stands for. And if it's not treated or managed, because once you have HIV, it's a virus you can't get rid of. But if it's not treated, it actually tears away at the immune system, which causes like pneumonia and eventually death. And it eventually turns into AIDS, which turns into death, acquired immunodeficiency syndrome. So HIV can turn into AIDS if you don't take the medication how you should. Now, what are some of the signs and symptoms? As we know, when it comes to HIV, you may or may not have any signs and symptoms. However, if you do get some, it's going to be very vague. Yes, it's going to be like fatigue, meaning tired. You're going to get some sore throat. You're going to get like flu-like symptoms, a little dry cough, but nothing, to the extent to say, oh, wow, I might have HIV. However, just know that it is spreaded through vaginal, oral, and anal sex. Yes, it is. And then, of course, from mother to baby. If the mother does not know she has HIV and she's breastfeeding, it can be transmitted that way. Now, one may ask, I just had sex with someone who I think have HIV. When should I get checked for HIV to see if I have it? I had unprotected sex. Well, you do want to get checked through every 3 to 6 months because it takes time for the antibodies to build up in the blood. So if you go 2 weeks after you think you've been exposed to the HIV, then that's not gonna tell you anything. You're gonna have to check about in 3 months, and then, well, you can check then. We always draw the blood then. And then we'll check again in 3 months, and then we'll check again in 6 months. Now, if you want to do the HIV testing in your home, you can. They actually have the HIV oral testing that's at like CVS, Walgreens. They have the kits that you can go purchase. It is a little bit, more on the expensive side, but some people would rather pay more than to, go get tested right away. By another agency. Also, if you feel like, say for instance, you do have a partner who, let's just say, got raped, and you still want to continue the relationship, or you have a partner who have HIV. And that's definitely a personal choice. They do have something called PrEP that's out there. They have PrEP. That's pre-exposure prophylaxis. Yes. It's Truvada, which is a medication, antiviral medication that you take once a day that actually helps prevent you from getting HIV. It does not prevent you from getting other STDs, so we still encourage condom use. But just so you know, there is something out there for you. And then there's also post-exposure. So for a lot of my healthcare workers or those who have been raped and who've gotten, stuck by needles or what have you, whatever the situation may be, if you go get the treatment within 72 hours of possible exposure, guess what? You can save your life from getting HIV. So, HIV has come a long ways. It's not a death sentence anymore. They have medication that can help manage it. They have medication that actually will have your blood being shown as undetected. So when you're talking to your partner, you need to have a serious talk. Don't just say, do you have HIV? You want to say, have you ever been positive for HIV? Because, some people, unfortunately, which is, leading people on, some people may say, no, my HIV is undetectable. I have undetectable HIV. And, at any time that can actually become detectable. So you do just have to be careful of your wording. Look at the test results really good. And just, choose your partner wisely. It's hard to say, who's going to have HIV. A lot of times HIV is spreaded to person because they do not know they have HIV. So that's why it's so important to know your health status, know your HIV status, and get tested often. All right, so that's the gist of it. A little recap of HIV. If you have any questions, you know where to find me. Have a nice day.